Hello everyone, this is Kerry Anderson. Hope you're all doing well. In today's video, we will be talking about what is the link between diabetes and stroke. So if you like the video related to my health my way, I will like to request you all please do subscribe the channel, hit the bell icon, and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. What is the link between diabetes and stroke? Diabetes means you have too much sugar in your blood, and this can make you more likely to have a stroke. This is because having too much sugar in your blood damages the blood vessel. It can make the blood vessel become stiff and can also cause a buildup of fatty deposit. These changes can lead to a blood clot which can travel to the brain and cause a stroke. Now, about diabetes. Your body controls the amount of sugar in your blood with a hormone called insulin. Diabetes develops when your body is not able to produce insulin, or the insulin it does produce does not work properly. There are two main types of diabetes. Type 1 diabetes means you can't produce insulin. It often starts in childhood, but adults can get it too. It affects around 10% of people with diabetes. Then it comes to type 2 diabetes, means that you don't produce enough insulin, or that your body's cells are not responding to insulin. It is mainly an adult disease and it affects around 90% of people with diabetes. Now I'll be talking about the gestational diabetes. Gestational diabetes is a temporary condition during pregnancy. It is usually stops after the baby is born, although it can increase the mother risk of developing type 2 diabetes in the future. Now, am I at risk of diabetes? Type 1. You are more likely to develop type 1 diabetes if you have close family members with the condition. Type 2. This type of diabetes is strongly linked to being overweight, but you can also get if you are a normal weight. You are at higher risk of having type 2. If you have a close family member with the condition, it's more likely to start over the age of 40. It's also more common in people with African and Caribbean, South Asian, and Chinese ethnic groups. If you're in the age of any of the high-risk group of type 2 diabetes, ask your pharmacist or GP about having a health check. It's recommended for anyone over 40, but if you are Black or South Asian, you can ask for a check from 25. So try the NHS Diabetes Know Your Risk tool, which gives you an individual risk score. You may be able to join a diabetes prevention program. So now I'll be talking about the symptoms of diabetes. Many people don't realize they have diabetes because it tends to develop slowly. Some people are only diagnosed after they have a stroke. The main symptoms of both type 1 and type 2 diabetes are being very thirsty, needing to pee more than usual, feeling very tired, and explain weight loss, often having thrush, cuts or wounds that heal slowly, blurred vision. Now I'll be talking about the diagnosing diabetes. Diabetes is diagnosed by a urine test or blood test. You might have a blood test which checks how much glucose is in your blood. An HbA1c blood test shows your blood glucose level for the last 2 to 3 months. A glucose tolerance test checks your blood sugar before and after drinking a sugary drink. Now, pre-diabetes. Type 2 diabetes can develop over many years, and your blood sugar can rise gradually if a blood test finds your blood sugar is higher than normal but not high enough to be diagnosed as diabetes. You might be told you have pre-diabetes. Many people can stop this progressing by making some lifestyle changes, such as losing weight and being more active. So now I'll be talking about diabetes education. If you are diagnosed with diabetes, you should be offered free diabetes education from the NHS, such as a course or an app. This gives you the chance to learn more about your condition, how to manage it. You might be able to meet other people with diabetes. Diabetes UK also offers a free online education course. So type 2 diabetes in me. Now, managing your diabetes. Patient with type 1 is referred to a specialist care team. They need to take insulin for life, and they need to manage their diet and exercise to stay fit and active and keep their blood sugar stable. If you're diagnosed with type 2 diabetes, you should have help from a team of health professionals, including your GP. You will have advice on your diet, food checks from a nurse or food specialist, and eye checks by an optician. You should have your blood sugar level checked at least once a year, and your blood pressure should be monitored. That's all about the diabetes in this video. I hope you all liked it. I'll definitely come in the next video with my another content. Till then, God bless you. Bye bye and take care.